If you've recently been diagnosed with head and neck cancer, you've probably heard words like mandible, pharynx, larynx, base of tongue, hypopharynx, and maybe you've even heard things like lymph nodes. You're sitting there and you're thinking, I absolutely have no idea what this anatomy means and where it's located. First of all, that's completely normal. As a speech pathologist and certified lymphedema therapist who works with head and neck cancer patients every day, one of our goals is to help our patients to understand their own body. Because when you understand your anatomy and treatment plan, suddenly everything is making a lot more sense. The head and neck is an incredible neighborhood. I like to think of your head and neck as one of your busiest neighborhoods in the entire body. In one very small space, you have structures responsible for breathing, swallowing, speaking, chewing, taste, hearing, and facial movements. These structures have blood supplies, lymphatic vessels, and muscular activity that all connect via nerves to our brain. It's an incredibly complex area, and that's exactly why treatment requires such specialized and multidisciplinary team. Let's start with the bones. Think of your bones as the framework of your house. They create the structure that supports everything else. Your skull protects your brain, and your maxilla forms your upper jaw. The mandible is your lower jaw, and it's actually the only movable bone in your face. Your cervical spine supports your head while protecting your spinal cord. Even tiny bones called the hyoid plays a critical role in the swallowing because it's suspended by muscles rather than directly attached to another bone. These structures aren't just anatomy textbooks, they are foundation for eating, speaking, and moving our muscles. Then come the soft tissues. Most head and neck cancers don't actually start in the bone. They begin in the soft tissue in the lining, called the mucosa. That includes areas like the mouth, the tongue, the tonsils, the throat, and the voice box. These muscles and parts of the body are surrounded by tissues. Your throat itself has different regions. We divide those regions into the nasopharynx, oropharynx, and hypopharynx. Each has a different function and a different types of cancer that can occur in those areas. Understanding where your cancer starts helps to explain why your surgeon or radiation oncologist team recommended certain treatments. The muscles that keep us moving. One of my favorite things to teach patients is that swallowing isn't just one muscle, it's dozens of muscles working together in perfect coordination. Your tongue is pushing food, your jaw muscles are chewing, the pharyngeal muscles squeeze food downward, and the hyoid muscles lift your voice box to help protect your airway. Your larynx closes to keep food out of your lungs, and all of this happens in less than seconds. When surgery, radiation, or tumors affect these muscles, rehabilitation becomes incredibly important because we're trying to preserve and restore these amazing movements. What about lymphedema? For my patients, anatomy becomes even more important. The muscles, the fascia, the lymphatic system, the veins, the arteries, everything works together. When surgery removes lymph nodes or radiation creates fibrosis, then the normal drainage pathways are disrupted. Understanding where those structures live helps to explain why we perform manual lymphatic drainage, compression therapy exercises, and mobility work as part of rehabilitation. Nothing we do is random. Everything is based on anatomy. If there's one thing I hope you take away from today's video, it's that understanding some of the basics of your own anatomy will help you to feel more confident, ask better questions, and become an active participant in your recovery. Here at Head and Neck Rehab, we believe education is one of the most powerful tools for your rehabilitation. If you'd like to learn more, follow along, download our HNC Lymph SLP app. This app has swallowing, lymphedema, jaw mobility, radiation recovery, and exercises in patient-friendly language. I'd love for you to subscribe, join us, and in the comments below, tell us what anatomy term has your doctor used that you've never understood. It might become our next video.